this rare condition, we now know this is what's been causing all of the spasms that I've been having.
This week, music icon Céline Dion disclosed a private health struggle that has delayed her tour. Dion was diagnosed with stiff person syndrome, which affects motor function.
Joining us to explain the condition and other neurological syndromes, is Medical Director of Neuroradiology for RadNet, Dr. Suzie Bash. Good morning, doctor.
Good morning, Doug. Thanks for having me.
I have to admit, when I first heard of Céline Dion's condition, I had never heard of this before. How rare is it?
Yeah, you probably haven't heard of it because it's very rare, 1 in a million. And it affects women 2 to 3 times more frequently than men. But it's a very rare disease.
What exactly is stiff person syndrome, and what are the symptoms that Céline Dion is dealing with right now?
Yeah, so stiff person syndrome, or SPS, is a rare neurologic disorder that has features of an autoimmune disease. So an autoimmune disease is when your own immune system mistakenly attacks normal healthy cells in your body. And so it's really characterized by fluctuating episodes of muscle rigidity, spasm, and stiffness. And also by heightened sensitivity to certain stimuli like noise or touch or sudden motion or emotional stress. And those stimuli can actually trigger spasms of your muscles, and they can be quite debilitating and painful, even can result in a fall. So you can see in Céline Dion's case, patients can have a lot of difficulty with walking and movement, and in her case actually can impact her ability to sing, because if the muscles related to phonation are affected, such as your laryngeal muscles or your diaphragm, your facial muscles, your tongue or your palate muscles, that can all impact, unfortunately, the ability to sing.
Is there certain activity that she could participate in that could perhaps trigger her condition?
Well, I think if you could try to avoid some of those stimuli that we talked about, like a sudden loud noise, but it's hard to avoid those things in life.
Especially when you're a performer on stage in front of 60,000 people.
Exactly.
Let's talk about diagnosis, because there's often a delay in diagnosis. And Céline Dion mentioned how rare it is. You said 1 in a million. So how is it diagnosed, and why is there a delay?
Yeah, well, there's often a delay just because it is so rare, and also because these symptoms of muscle rigidity and spasm can be seen in other diagnoses. So like, for example, Parkinson's disease. Parkinson's is 1 in 1,000, or ankylosing spondylitis. Again, that's about 1 in 1,000. Even multiple sclerosis is about 1 in 750 people. So you can see why there could be a delay in diagnosis.
And how is it diagnosed? You were going to...
Yeah, so, it can be diagnosed by a simple blood test. So basically, this disease is, primarily related to antibodies against a certain enzyme in your body called GAD. And so these anti-GAD antibodies will block that GAD enzyme. So basically, GAD helps prevent our nerves from overstimulating the muscles. So when we lose that inhibitory response, you end up with increased muscle activity. So the diagnosis is made by the classic symptoms, which we already talked about. And clinically, the most common finding is very rigid muscles, almost like board-like muscles.
Wow.
And then you can do the blood test to look for those antibodies, and there are also other tests that you can do as well. And interestingly, you should also probably screen for other autoimmune diseases, because you can see other autoimmune diseases that go with this. So actually 30% of patients with SPS have type 1 diabetes as well.
So how might this condition impact Dion's ability to perform, and could the condition get progressively worse?
Well, it could impact her ability to perform because of the problems that she may be related to her voice, and even on stage with, muscle activity and motion and things like that. But yes, unfortunately, the general, the prognosis is guarded, because symptoms often will get worse over time. Although there are treatments out there, there's no cure, but there are treatments out there that can really help mitigate these symptoms and, help make them better. And, hopefully, and there's new treatments that are coming all the time. There's active research in this, but there are some good treatments on the market right now.
Is it preventable?
So I'm not sure that you could really prevent this, because it's an autoimmune process. But again, you can use these medications to help, prevent the symptoms.
I know you mentioned how rare it is, but are there signs that people can look for?
Well, I think that if you have any kind of health concern, it's always very, very important to consult your doctor. But in this particular case, that is really the primary symptoms are going to be that muscle rigidity and spasms and stiffness that go along with this disease.
Well, thank you so much for explaining it to us. You know, it made big news this week when Céline Dion made this announcement. And of course, we really feel for her with what she's going through. So thank you. And for more on Dr. Bash, you can follow her on social media or visit radnet.com. You see all the information on your screen right there. Thanks again.
Thank you.